All right, Thursdays typically when we talk medical issues. So this morning we have Dr. Francis O'Donnell, Frank O'Donnell, is here talking about headaches. He's the new headache specialist at New Hanover Regional Medical Center. So obviously this is something I think I'm safe to say everybody has dealt with once or twice or maybe several times in their lives. At what point are headaches severe enough that we were to come see someone like yourself?
Headaches typically are not something that one has to worry about, but when there's any red flags, so to speak, maybe if you've suffered a head injury, a fall or something like that, we worry about serious bleeds into the head when there's an injury or a trauma. Sometimes if there's a headache or neurologic symptom with your headaches, something along the lines of losing consciousness or a seizure, any speech difficulty, motor problems, limbs aren't working, those kinds of things, any neurologic symptoms. Fever with headache is always a concern. Sometimes the persistence of headache or a change in one's headaches, headaches with exertion, for example, people do suffer intracranial bleeds sometimes, and those can be associated with exercise. If the headache comes on with exertion, or with postural changes, bending over or changing one's posture. At a headache onset in patients, or a change in their headaches after the age of 50 is always a concern. So older patients.
Okay, I was going to say, because I know, all of us, we know pain varies. You can have, someone can say, I really have a bad headache, but they may not know what a really bad headache is. I mean, when folks have something like a migraine, is that also something that would lend them to seek out a specialist where they can maybe get themselves under control with these?
Yes. A great deal of my time is spent dealing with people who have very severe migraine headaches, or very frequent migraine headaches, headaches that really haven't responded to the typical treatments. So they wind up putting together, or we wind up putting together, once we've eliminated more serious causes, we wind up trying to help them put together treatment programs, which oftentimes include pharmacologic or drug therapies, and sometimes alternative or complementary therapies, physical therapies, counseling, nutritional therapies, and education, exercise programs, trying to help them identify all the factors that contribute to them having frequent headaches.
Yeah, because I was going to say, I would think most times, if someone is having a headache, say for day 2, 3, 4 in a row, they go to the general practitioner, then maybe that they start to discover, okay, this could be symptomatic of something else. For someone watching at home that thinks they may be a candidate for a service like yourself, what is something that they would need to do? Should they seek their general practitioner before contacting someone like yourself?
That's a good question. Many people do go to their family doctors or their general practitioner and get help for their headaches. If they're not responding, they are typically referred to a headache specialist or a neurologist who specializes in headache. Some patients on their own seek out a specialist, and they have not necessarily seen their doctor recently, but they've maybe been to doctors in the past for their headaches and not gotten any relief.
As I said, it's nice now that, if someone chooses to cut out the middleman, that we have the man in town as opposed to going out of town.
It's great to be here.
Thanks for coming in. We appreciate it.
Thanks for having me.
New to the area, so it's another thing that New Hanover Regional Medical Center, again, just bringing in the best to take care of us here at home.